Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on COVID-19 for the week ending March 11th, 2021. As always, my first question is, how is the pandemic progressing globally in the United States and in our region? Secondly, I want to talk about the CDC report this week on what people can do if they've been vaccinated. And third, what's the status of new viral variants and why they're important? In terms of global progression, we've had over 2.5 million deaths worldwide, 118 million cases. And last week we saw a 2.1% increase, which is a very low increase. And you can see this based on the last couple of months. 2.1% is actually the lowest we've had. But even with that, there have been 54,000 deaths last week, which is over 5 deaths every minute. So I want people to understand that this pandemic is not over. Even as it slows down, as it has done before, it is still a significant pandemic. If you look at the daily number of deaths, you can see that while it's been coming down for the last month or so, it is still well higher than it was for most of the summer, and even higher than it was in the peak in March and April. In the United States, we've had 540,000 deaths and a 1.7% week-to-week increase, a nice slowing down, lower number. Again, one of the lowest percent week-to-week increases that we have had. But even with that, remember, there were almost 9,000 deaths in our country last week, and that's almost 1 death every minute. And if you look at the number of daily deaths, you can see that while the number has come down in the last month or so, it is still higher than it was for most of the summer. If you look at where the total number of cases have been from August, September, October, November, December, January, February, March, you can see that this pandemic is continuing to spread with now it appears, a particular focus in rural America. If you look at where the cases have been the last 2 weeks, again, from August, September, October, November, and December, we see that explosion, January, February, and now March slowing down. So again, this pandemic is coming and going. It rises and it falls. In our region, we're seeing relatively low number of cases now. If you look at the states in our area, widely different number of deaths, but based on population per million, South Carolina and Tennessee are about 50% worse than the other states. Most of us are seeing a relatively low week-to-week increase, except for Virginia. But remember, 2 weeks ago, it was 12% in Virginia. Last week, it was 17%. So I still don't quite understand what's happening in Virginia. I want to keep an eye on it. It does look like the numbers have gone up pretty quickly, but maybe they're slowing back down again. In our region, almost 2,000 deaths and a 2.6% increase in the past week. That's 49 deaths last week, which is 7 deaths a day. So again, while the numbers are coming down, and that is reassuring, we are not out of the woods by any means. The pandemic is slowing down globally in the US and in our region, but it has not stopped. Now, fortunately, many people are getting vaccinated. And this week, the CDC came out with an interim report for people that have been fully vaccinated. And they're now saying that if you've been fully vaccinated, you can visit other fully vaccinated people without masks or social distancing. And you can even visit unvaccinated people from a single household if they are at low risk. And you can refrain from quarantine and testing if you're following a known exposure, if you're asymptomatic. It's a little bit confusing to people because you say, well, it's not quite logical. But what they're basically saying is, here you can see if you've been vaccinated, you can visit folks who've been vaccinated. You can visit a single household that's been unvaccinated as long as they're at low risk. But if anybody is at high risk or more than one household, you can't visit. So again, a little bit confusing. And, oftentimes when these recommendations come out, people only read what they want to read. They only see what they want to see. So it's important that you understand the CDC is still saying even fully vaccinated people, when they go out in public, need to wear a mask and engage in social distancing. And especially if they're going to be around anyone who's at increased risk, of COVID-19 deaths, those who are elderly, those with chronic conditions, and so on. Wear masks, maintain social distance when you're with people from multiple households, avoid medium and large-sized in-person gatherings, get tested if you experience symptoms, follow the guidelines issued by your employers, and travel and recommendation guidelines. So a little bit confusing, but it is good to see that we're being allowed to open up a little bit if we've been vaccinated. Now, one of the concerns people have is what's going to happen with these new variants. Well, there are three that we're keeping an eye on. The so-called UK variant, which had over 3,000 reported cases in the US, and not everyone's even reporting them anymore. The so-called South Africa variant, almost 100 cases, and the Brazilian variant, about 15 cases. And there are a lot of other variants out there. But why do we care about that? Well, all viruses mutate. And when they mutate, they can become more or less lethal. They can be more deadly or less deadly. They can become more or less communicable. They're easier to spread, they're harder to spread. But also they can become more or less susceptible to natural or vaccine-produced immunity. So you might be immune to the existing variant of the virus, but if it changes enough, you may no longer be immune. And that's why the longer a virus is spreading in a community, the greater the chance of something bad happening. That's why we've got to continue doing the things that we know make a difference. Wear masks, avoid crowds, practice social distancing, get vaccinated. The sooner we get this virus under control, the less chance there's going to be that something bad is going to happen. So the virus is slowing down. We are being given guidelines to loosen up a little bit, but there are these new variants on the horizon that should keep us all a little bit worried. A great deal more information about COVID-19 on the College of Public Health website. As always, if you'd like to be added to this mailing list, please contact Jan Stork or let me know by return email. Thanks as always to Melissa White for helping collate data and for Darian for editing, producing, and posting this video. As always, if you have any questions about COVID-19 or anything that I've said, please let me know. I look forward to hearing from you. Thank you very much, and please be safe.